Hey, everybody. This is Chris.
And Cathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
You can also support the show by making a donation. Simply go to our show notes and click the link at the bottom of the page of any episode. Thanks for listening.
We hope you enjoy the show. Welcome to PetAbility. I'm your host, Cathy Simons.
And I'm your host, Chris Cranston. Our podcast provides interviews and information to help your pets live their best lives.
Good morning, Chris. How are you today?
Hey, Cathy. I'm doing pretty well. How are you?
Chris, I'm doing really well because today is the most special day of all the days. Today we are recording on May 3rd, 2022. And do you know what today is, Chris?
Do tell. I don't.
Today is Nationally Specially Abled Pets Day.
That's amazing.
Today we celebrate all of our specially abled pets. And that's all the pets across the board, our dogs and our wheelchairs and our cats and our birds. Everybody, anybody who's specially abled, we're being celebrated today. And those
our betta fish, our tortoises.
Right, exactly, everyone. So I'm really excited about that because I think that we should celebrate them just because they are, a little bit, maybe they move a little bit differently, but they're still our pets and we still love them and they deserve that. Absolutely. So I know, and I was watching the television the other day. I was watching, I don't know what I was watching, probably The Price is Right, because I love The Price is Right. But I stopped, it stopped for a second and I'm watching a commercial for Bissell. Have you seen this Bissell commercial yet, Chris?
I just saw it the other day and I paused it and I called to my partner. I'm like, you got to come see this.
Right. I was watching it and all of a sudden a dog, they're talking about their Bissell vacuum and a dog appears on the screen who is in a wheelchair, a front end wheelchair.
Yeah.
So this dog, a front end wheelchair. Chris, I just lost it after that. I paused it. I did the same thing. I was like, Tom, you've got to come over here. There's a dog. And it's somebody that we follow on Instagram. And the dog's name is Austin Rue. And he is a two-legged dog in a wheelchair. And he's doing he has a fantastic life. So kudos to Bissell. We're going to be talking to Austin Rue's parents in the future, hopefully soon. But I love that they're being represented on television and in commercials and celebrated. So, we also have some really great news to share with the audience. Something great happened to us over the week, right, Chris?
We sure did.
We were contacted by a woman named Erica who had 100 dog slings to donate to us, brand new in the package. And if you want to check out Erica, she actually is on Instagram. I believe her Instagram is Silly Monkey, and she does knitting and stuff like that. But she donated these harnesses to us, and we're going to be able to help so many dogs with those harnesses, Chris.
Yeah, I picked them up from her. She is a lovely woman and so generous and kind. And she was so humble. She's like, oh, this is just a small donation. And I'm like, no, this is a huge donation. So 50 medium, 50 large, they roll up. They're great for kind of maybe an emergency situation, like you put them in your car and you have it there just in case. Yeah. And maybe it's one of those Murphy's Law things. If you prepare for it, you won't actually need it.
I gave one to my groomer to keep at her shop just in case they needed something extra to help their patients get up on the table. She was very grateful. And I think it was wonderful. So thank you, Erica. And you can check Erica out again on Instagram at Silly Monkey.
So just one final thought that I saw this week was in the New York Times, there is a official Guinness Book of World Record holder for the oldest living dog. They proved his actual age. He is a Chihuahua that lives in Florida, and he is over 21 years old. Now this
Whoa.
Now this isn't the oldest dog to ever live. That was, I think, an Australian Shepherd that lived to be 25, which is just unreal.
I know.
But this is currently living at this point in time. And I'm sure now that this has been publicized, there's going to be other people like, wait, my dog's older. But Guinness had to, prove the actual age. And this woman has owned this Chihuahua since she rescued him. He was a rescue from a shelter when his elderly family could no longer care for him, and so she's had him since he was a puppy. So pretty cool.
You go, little Chi-Chi. You go.
Yes. The thing that really resonated with me is he goes out on several walks a day. A longer walk in the morning, several shorter walks throughout the day. And that's what we preach all the time. Keep them active, especially we know all these dogs get arthritis, and movement is essential for managing arthritis.
Chris, that's a fantastic story. Keep them moving, even if it's just a little bit every day. Move.
Yep. Which is kind of a nice segue into our topic, because today's topic is on massage, and massage is another tool that we can use to address pain and keep our pets moving comfortably.
And you know what, Chris? I think that people, they may not realize this, but I bet they do a little bit of massage unknowingly, maybe, with their pet anyway, like sort of naturally.
It is very instinctive. So as you say, you're kind of unwittingly providing these therapeutic measures. I often say that, massage isn't a whole lot different than petting, but it's just a matter of intention. So like you said, if people are kind of mindlessly, petting their dog or cat or other animal, when maybe they're watching TV, their focus is on the television. They don't even realize what they're doing, but they are providing therapeutic measures. If they turn their attention from the TV and did the quote petting with more intention, then it becomes massage. And the more we practice, the better we get.
And once you change the intention, we can then start targeting groups of muscle, or, along the back. We can do the shoulders. We could do the hips. I naturally sort of skin roll my dog too, because he's a pug and he's got a lot of extra skin. I don't know that people understand, but that's really actually a technique too, that skin roll.
And, as I was thinking about this show today, I was struck by, this is probably one of the oldest forms of quote physical therapy that we have, because and I use that term kind of loosely. It is a physical measure, it's a physical modality that we're applying to a being, a living creature, to evoke therapeutic effects. So in that sense, it is a physical therapy. Oldest time.
And the things that we're doing, and it may seem benign, right? It might seem like it's that you're not doing that much. Maybe it seems like we're just, like we're petting and we're skin rolling. But really what's happening when you're doing that is we're increasing oxygen to the tissues, and the tissues are getting rid of waste, and the muscles are becoming more elastic, and the soreness of the muscles are decreasing. And so even though it might not seem like a lot, right? It's very beneficial.
Yes.
So much benefit.
Yes. It's simply the laying on of the hands, get your hands on your dogs, people. And, it affects all systems of the body. So, I think we typically go to the muscular system, right? When we think of massage, but it's affecting our nervous systems, our respiratory systems, our circulatory systems, which is not just blood flow, but also lymphatic flow. The lymph system gets rid of our waste. It is another system that requires movement and circulation of fluids throughout our body to make us feel our best. So, it's affecting everything. And let's expound on more of the benefit.
You used an example in another episode that we talked about something, and I don't remember which episode, but you were telling me, have you ever stubbed your toe on the coffee table? And I said, oh, that's the worst. She said, what's the first thing you do? I said, I grab and I start rubbing the toe. Right.
Yep.
And I do it instinctually without thought, because it makes it feel better.
Right. And again, you might just kind of squeeze it and hold it initially. Right. Because it might hurt too much to actually like rub your toenail or whatever. But then over time, as the inflammation is dissipating and so forth, you do different things. So that kind of speaks to, how we have to listen to our pets. And we'll talk about that a little bit more in that, you're not applying the same technique, the same pressure, the same direction all the time. It's what is the effect that you're trying to achieve? So that brings me back to benefits. Is it relaxation? Is your dog all wound up, or is your cat stressed out because, you brought a new pet into the household and they're like, what? And, you want to go and have some bonding time and just relax them. So that's a different type of massage than maybe one where you're trying to wake up the nervous system. So then you're going to be more excitatory, more vigorous movements, circulation, swelling. Maybe they're swelling from an injury is pooling south. Gravity takes things down towards the floor, toward the ground, if you will. So thus, like the dog's feet or the cat's feet. So you want to kind of squeeze and milk those fluids up to decrease that swelling. That's another benefit that can happen.
And then with my toe analogy, decreasing pain, in those muscles or in those tissues. That's one of the great benefits of massage therapy. And when you're doing that, just that touching also, one, I think, it helps, like you said, with reducing anxiety, but also think of the body awareness that we're giving this pet as well. So they hurt their toe and you rub it and it feels better. But think about all the receptors in the feet and all the information that they're getting just by simply touching them.
Right. And maybe that dog hasn't thought about their right back fourth digit in a long time. Like you said, that seems silly.
Yeah.
But a lot of what we do as rehabbers is increasing that body awareness, and specifically of the hind feet, because they're the farthest from the brain. And
right.
So, it's kind of becomes easy to become on autopilot, as we, our pets negotiate their environments and things and not really pay attention. And when our dogs have an injury or get older, they lose that sense of spatial awareness with their limbs. And so anything that we can do to promote that is going to be a good thing.
Yeah. And maybe you don't think that there's great importance to the back left outside toe, but there really is. It does a lot of stuff.
Yeah. The entire body and touching areas that aren't normally receiving stimulation.
Right.
So like an area that I think of is kind of like maybe the inner thigh. Right. There's so many muscles and things in there. And, but because of that location, unless your dog is one of those that flops on its back and, spreads its legs open, you're probably not touching there a whole lot, but it's important to go everywhere.
Right.
Their armpits, between their toes, their ears, all the way down their jaw, all the way down their tail. But let's put a caveat there too, that some dogs may have had trauma, either physically or emotionally. And so maybe they don't like their tail touched, or they've had a history of ear infections and they're very reticent to have you massage their ears because of past experiences or maybe even existing discomfort. So we have to pay attention and honor that and listen to our pets.
And we always say, before you start any of these things, anything that we recommend, it's always best to talk to your veterinarian first, so we can identify areas that maybe they're painful or maybe sore, or again, the ear infection or the tail. I have a patient who had a pretty traumatic anal gland expression, and it's very difficult to get to the base of his tail and around that area because he's frightened of that. So always, if we can identify these areas ahead of time, that's fantastic. And then we know we either have to go light touch here, maybe avoid it, or maybe use a different type of technique. And touch in itself, just touch in itself is the biggest part of massage. And touch is really one of the most sensitive of the senses. And maybe you think it doesn't because you touch your dog all the time, but it can be very powerful. It can communicate intention, good or bad. It could calm a frightened animal maybe and further nurture that bond. But remember, it can also be annoying, intrusive, or painful.
Right, right. And you just mentioned bond. And and that's kind of one of the things too that I really wanted to emphasize is through that physical touch and that communication through our receptors, back and forth, it really does enhance that bond and work toward creating more trust between you and your pet. And you talked about, go to the vet, which I 100% support, to learn maybe areas that we should avoid or be aware of in terms of an issue. But I was actually thinking when you were saying that, the opposite. I think we have great value as pet owners because we have such instinct and communication with our pets on a subliminal level that oftentimes when we trust our gut, we can identify things that aren't going to be obvious in a veterinary setting because, that's artificial too, right? And they're maybe a little amped up and their nervous system is overriding things. But, how many times, Cathy, have we heard a pet owner say, whenever I touch my animal here, I feel the skin quiver or there's a spasm or when I stroke my dog down over their back, they sink down away from me, toward the floor in an attempt to maybe avoid that pressure. So those are things that we can also bring to our veterinarian, let alone what about all the lumps and bumps? Right. Is it a new lump or bump? Has it always been there? Have we tested it? What is it? Is it benign? Is it, something more, nefarious in terms of cancerous growth or something? So we can bring a lot to the table through massage.
You're absolutely right. And getting familiar with your dog's body and what's normal and not normal for your dog.
And so some of the things that we can determine, with our hands, in addition to what we've already mentioned, is again, maybe swelling, right? Like if you feel one side of their body versus another side of the body, you might notice that, wow, it's bigger on this side and it feels kind of boggy and squishy. That could be indicative of an inflammation, of swelling, or vice versa. Maybe you compare two sides and wow, this leg seems smaller and more bony. It doesn't have as much muscle. There's atrophy there. Is there atrophy because the dog is so good at masking how they're using their limbs? They have three other legs to walk on and they're not really engaging their muscles on that side. And so the muscles are wasting. Maybe.
Right. Maybe.
Also,
especially with your senior dogs, you're going to see. Yeah.
And then warmth, I think this is hard for people to appreciate, but what I've told folks is to, use the back of your hand, glide it over tissues, and there are naturally warmer and cooler areas. Dogs with chronic issues, sometimes the tissues will actually feel colder. Like hip dysplasia, over the hip, it feels cooler than maybe it does up along their spine and their back. Or maybe you're gliding down and wow, that knee feels really, really warm on the back of my hand. Let's check the other knee. Same time. Nope, that one doesn't feel as warm. So is there something going on there? Tenderness, a sore spot. We've already talked about the muscles and relaxation and loosening tissues. Is there a tightness? Is there a ropey feeling? Is there a knot? Is there spasm? Is it skin spasm or is it deeper than that? Are the muscles really spasming? Is the whole leg shaking when you do a particular type of touch?
Does the dog look back at you when you touch a certain area? Do they whip their head around and take a look, at what you're doing? Those are also an indication of, that might be an area of discomfort. And one of the things I'm not sure we mentioned this, Chris, in our list of benefits, but the flexibility of muscle tissue after you've massaged it. And having good flexibility is essential to everyday living. Especially if you're a senior dog, you've got to have flexibility.
Right. And flexibility is one of the key components of overall fitness and wellness. We often think about strength and maybe not so much about balance, but certainly very few people think about flexibility. And you can't strengthen muscles appropriately and move appropriately if you don't have the capacity to move within your normal range and be flexible. Plus, mitigating injury. Because if you're super tight and not flexible and you stumble, then you're much more likely to strain or sprain something because you don't have that flexibility to adapt, when you hit the ground or catch your leg.
Yeah. And it's the flexibility is essential to everyday living for these animals. They have to walking, running, stair climbing. It's essential for everything that they do. All the movements that they do, they need to be flexible for.
Right. And we often see in rehab, short strides, maybe because of an injury or over time, as you mentioned, with aging, everything just gets more compressed and less fluid and less flexible.
So should we talk a little bit, Chris, about like the prep just before, what how do we want to set the scene when we're getting ready to massage our pet?
Yes, let's do that. So I guess one of the first things I think about is what mindset am I in? I don't want to go in there all jazzed up and like, okay, we're going to do a massage. That's counterintuitive. So, I think maybe it's better to skip the massage at that point in time or reset yourself in some way to ground yourself and, to maybe do some deep breathing and things like that before you actually lay your hands on your pet.
Right. You've got to change your mindset. I've said this before and I'll say it 100 more times. Your dog is an emotional barometer, and they feel what you are feeling, and that will translate to the dog, via an extension of your arm and hand, it will translate to them. So we do need to have a calm mindset when we're getting ready to do this.
Right. And then I think creating a calm physical space, so if you have an active household, kids are running around, you have multiple pets, somebody's making dinner in the kitchen and clamoring with pans and there's smell of foods, that's probably not the time or the place to do it. But if you can go to, maybe a separate room, put on some music to maybe block out, calming music, not, rock and roll, that evil rock and roll. But, and again, just a comfortable place, whether it's, you put a small dog up on a bed or, next to you on the sofa or, your larger dog on the comfortable dog bed, because you are in theory going to be applying some pressure. So you don't want to be, pushing down onto a hard floor, like a wooden floor or, something like that.
Something supportive and comfortable.
Yeah. And eliminate those other distractions by being in that quiet place. The other thing I've been starting to do with all my patients is, maybe we've done some exercise and now it's time to do some massage. So we're switching gears. And I want to give them a stimulus cue, a signal that, okay, now we're going to be relaxing. We're going to lie down and we're going to do the rubbies. I take off their collar. I take off their harness. I take off their booties, whatever it may be. And that, the first time they may be just like, oh, I always have my collar on. What are you doing? But over time, it's like, oh, I know what's happening next.
Yes,
or
exactly.
Again, maybe that stimulus cue could be you go to that special place. You go to the den.
It becomes predictable. It becomes a predictable thing for them. You know what else I recommend that people do or not do, actually, because I know I just said your dog's an emotional barometer. You know what else they are? They can keep time. They can keep time because if I were to start to massage Mac around 3:00, which is his dinner time, he would not forget that. I typically will not typically not do the massage just before a breakfast or a meal time because my dog will not forget it.
He's hungry. He's going to be thinking about
food.
What? Yeah, food. I don't want to, I'm not going to lay still here. What have you gone crazy, Mom?
It's almost 3:00. And don't think he'll forget either because he'll start reminding you it too.
Well, and let's talk.
Something to think about,
Yes. And let's talk about treats, to treat or not to treat, if you will.
Right. Good. That's a tough one because sometimes if I'm seeing patients, I'll use a treat to lure them into position and then we get in position. But some dogs are really like super hyped about taking the treat. So it's kind of an individual thing. If I know a dog is going to be really hyped up about the treats, I don't bring them out maybe till the end if I do.
Right. Yeah. Reward them for a job well done.
Right.
But yeah, and I've seen it many times too. I mean, again, my clients are well-intentioned, but I'll get the dog, down and relaxed, and I start doing their massage, and they're like, "Oh, they're being so good," and they reach over for the treat jar, and boom, the dog's up, and we have to start over again. So yeah, I definitely agree with your point of it's an individual thing. I think most of the time I don't offer them treats while I'm actually doing the massage, because even if they're good and they're going to stay down, I do feel some tension, as they reach for that treat. Right. Again, maybe it kind of breaks the Zen moment. And they're chewing, and plus I don't want to treat them when they're lying down, right? That can be dangerous in terms of choking and so forth. So to lure them into position, treats to reward a job well done, and then use discretion in between.
Exactly. We don't want to get hype in between. We want to maintain that space of calmness. We want to maintain that space. So Chris, the other thing that I might do, actually I do this quite a bit with a product called Chill Out. I love it, is use scent in the room. And the idea of aromatherapy in veterinary medicine it's relatively new. But nevertheless, there are some studies that offer some validity to aromatherapy. Dr. Deborah Wells conducted a study on dogs with travel-induced excitement, and she used the scent of, she used lavender. And what they found when these dogs were exposed to the scent of lavender in the car during their travels, they were overall calmer. And I think there is some validity to that. Now, I think we talked to Lori Chamberlain the other day, and Lori Chamberlain said, or a couple of months ago, about Fear Free, and she said, smells are so vital, so important to consider when you're thinking about the environment of putting a dog or a cat in there. I mean, it would be great if it smelled like tuna or liver. I mean, I don't think I would like that, but maybe they would, or maybe it'd be too much of a stimulus. But in any case, I think that there are some studies that show that lavender, or the scent of lavender, can be overall calming for the dog.
Well, and I wanted to remind people, we may not smell the remnants of that spray that you put on the bed 3 days ago, but they do. Remember how sensitive their sense of smell is. And so don't overdo it. Don't make it, obnoxious. Trust that they're smelling it. So
it's way superior to yours.
So let's talk a little bit more. We're kind of slipping into this whole concept of, setting the scene, getting buy-in, and ultimately consent from the pet to engage in massage. And consent may sound silly. It's kind of a novel new term that we're bantering around these days, but so important. And Cathy, you are the queen of consent. So can you describe what that means when we want to massage our pets?
Right. And when I think about when I want to massage a pet, I don't want to do something to your pet. I don't want to push something on your pet. I want them to be a part of what I'm doing, so that they not only enjoy it, right, but they're getting the maximum benefits from it because they're involved, they're in it. So what I look for dogs when I'm starting to get them ready, for massages, are they comfortable? Right? Are they in a nice, comfortable position? Sometimes dogs will do that heavy sigh when they finally lay down in that comfortable spot. They're like, this is great.
Yep.
And I look for that sort of sigh, that release of energy. I look for the facial expressions too. Are they soft? Are the ears soft? Is the tongue out? Is the tongue relaxed? Is the jaw tight or relaxed? And if it's not, then maybe I just start with, I'm going to put my hand on your back, and we're just going to sit like this for a second and see how this goes, and see how you like this, and see how this feels for you. And if they start to relax, then I'll move into some tissue work. But I'm constantly assessing at each stage of the massage, what is the dog feeling? What is the dog experiencing? What are they seeing? What are they feeling? What are they smelling? And are they still engaged with what you're doing? Now, if they don't consent, Chris, they will often move away from you. Sometimes they get a quick look back, like, hey, what are you doing back there? Cut that out. Sometimes it's simple things that you have to look for, like lip licking, yawning, things like that.
Subtle signs of stress.
all signs of the possibility of stress, or, I'm maybe on a muscle that's tight or tense, and they're letting me know this is, I don't like this. Mm-hmm. I'm uncomfortable with this. I have this patient who I love very, very dearly. Her name is Elsa, and she is a wheelchair girl. She lives the wheelchair life. And she is so expressive with her facial expressions that there really leaves very little doubt in my mind whether she is involved and okay with what I'm doing or not. And oftentimes when she is involved, she will fall asleep. And if I stop massaging her, she'll wake up and look at me and be like, what the hell?
You done already?
Are you? Yeah. Listen, TikTok, you still got 15 minutes on the clock, girl. We still got some tissue to work here. And then, of course, when I get to areas that are tight, like her shoulders and stuff, she'll let me know. So I think it's also a matter of like bonding with that particular patient and getting to know what that patient's face looks like, what their facial expressions look like, what their body language is. And, as a canine rehabilitation practitioner, I find this one of the most rewarding parts of my job is understanding this dog or this pet or this cat and really connecting with them on that level. I mean, touch is so powerful, and just to have them allow me to do it is actually rewarding for me. It's almost an honor. I'm going to allow this to happen. I'm going to allow you to do this. I trust you enough to do this. And now there are some patients who don't. I had another dog named Elsa who made it clear that this was just a business transaction. And I took those seriously. I did what she would let me do with her consent. And then I would try again with some other stuff next week, and I knew what her signals were. So.
Yeah. And this probably sounds, maybe a little daunting because you're like, I don't know how to read signals. But again, with practice and your own dog, you have an N of one, we're treating, many pets and have for, 20 some years. So the things that Cathy is describing are things and skills, I should say, that have been honed over time. And, I think just to put it very simply, you're never forcing, you're not forcing them into a position. You're not holding them down. By gently and gradually introducing your touch and then just taking a moment to feel their response, that's you asking permission. And if they don't react in an adverse way, then they've given consent. You may proceed to the next thing, but checking in at various times, because again, we can't make an assumption that just because we got consent in the beginning, that they're going to, allow all the things that we want to do in the course of our time with them. So,
and so my question then, I think that I might get from clients is, well, listen, I got 15 minutes still left here on this massage. Why can't we work through this? Why don't you push through? Like, what are the consequences of us doing that, Chris? What are the consequences of us pushing through a treatment?
Well, not only won't it be effective in the moment, because worst case scenario, if you're not listening to the pet, they could not just simply go away, which is kind of one of their first signals, is to remove themselves from the situation. But you follow them across the room and you proceed, it could escalate into a physical encounter. They don't want to do that. They're trying to give us signals, but if we're not listening, we could end up getting bitten. But then over the long term, if you don't go through this process, and again, think about your pet. You may be introducing this when they're a year old. You expect to have them for 15 more years. Right. You want to do things right in the beginning so that the next time, maybe you only got 2 minutes. The next time, maybe you'll get 5 minutes. And the next week, maybe 10 minutes. So being patient and taking your time and reading those signals and getting consent is going to make it for a better long-term relationship, making it positive and ongoing for their lifetime benefit. So Cathy, before we get into some of the specific techniques, I think this might be a good time to talk about one of our sponsors and give a shout out and thank them once again for supporting our mission and show. I think maybe talking about the Heads Up Water Collar is great. at this time because we're moving into spring. As Cathy mentioned earlier, we're at the beginning of May, and our dogs are going to be getting out in the water more if you're not lucky enough to live in one of those forever warm areas of the country.
Chris, this is a very unique product. And one of the things that really stuck with me and caught my attention is the fact that the collar keeps your pet's head and nose above the water, which is something your life vest can't do. And It keeps your dog's head and nose above the water, even if they become unconscious. So if they have an accident in the water, there's still going to be a flotation. They're still going to keep their head and nose above the water.
Yes. And it's called the Heads Up Pets water collar because that's exactly what it does. But they have an alternate website because it ultimately saves your dog from drowning. So it's called SaveDogsFromDrowning.com. You can use either one. And I think, to my knowledge, it's the only product out there that does this important task to save our pets' lives.
These ladies are doing important life-saving work, and they help support our show. So when you go to Save Dogs from Drowning, make sure you use our promo code PETPOD22. That's PETPOD 22, all capital letters. You'll get a 10% discount on your order, and you'll help support our show as well.
Awesome. Check them out. So let's move into some specific techniques and try to describe what those might look like. And I know it's maybe hard to envision, but we're going to do our best. And we also have a paired YouTube show on some of these techniques. So, so pictures, video, that's worth 1,000 words, but we're going to give you 1,000 words right now, just to, if you don't get a chance to check out the YouTube video right away and you're listening now.
Yeah. And I think that the two most common types of massage that we see, Chris, are in patient care is effleurage and petrissage. Can we talk a little bit about the difference between those two?
Yes, those are the two kind of umbrella terms. And I typically start my massage session with effleurage because it's lighter, it's more diffuse. You can use your whole hand with your fingers extended and basically, rub from, head to tail, up and down the legs and so forth. Now, having said that, generally you want to, once you kind of get into it and you've introduced that you're doing this touch, you generally want to try to follow the venous return of blood flow, which is counterintuitive because it's opposite of your pet's hair or fur growth.
Right.
So going toward the heart, if you bring your pet's front limb back along its side, where its elbow bends is where the heart sits. So generally those long diffuse strokes are all going toward the heart, toward the body's center.
Right. And this is this technique is actually a light gliding stroke. And like Chris said, with the palm of your hand, or maybe even with a little bit, adding your thumb in there as well. And we're going to push everything towards the heart. So if you're doing limbs, we're going to go up the limb. If you're doing the back, you're going to go towards the heart. If you're doing the head or neck, you're going to go down towards the heart.
Right. And this would be a time to kind of tune into those lumps, bumps, possible ticks, things like that, and getting your dog relaxed. Oftentimes I, will start this technique in the position that the dog offers me. So they may be standing, they may be sitting, but ultimately as they relax or over time, over continuous sessions, I prefer to have the dog lying comfortably on its side. Yeah. And it may take a little bit to get there, but we call that lateral recumbency. And the reason that we want that is because then none of the muscles or tissues that we're trying to treat are engaged. Everything is relaxed. The ground, the floor, their bedding is supporting them. And so we're not having to overcome tension and tightness as they're engaging those muscles to fight gravity when they're upright.
Right. Exactly. I prefer that too. And sometimes what happens is I'll just start doing a light touch when they're sitting. And then ultimately they sort of go, okay,
Yep. Yep. Yeah. And they may be panting at first, and then, then their mouth closes, and then you can just kind of feel them melting, under your hand.
Yeah.
Don't overthink this. Again, it, like I said earlier, it's not that different from petting, maybe just paying attention to the direction of your stroke, starting light, maybe gradually getting a little bit deeper, assessing some of those things that we talked about earlier, paying attention to, is there an area of sensitivity? Are they looking back? Is it a painful area? And you may want to avoid that at first. And then when they get more relaxed, you can work toward that more sensitive and painful area gradually if you get that permission.
Yeah. And what I'll do gradually then is move in, typically, Chris, to the Petrissage technique, which is more of a kneading or rolling or compressing. And I feel like with Petrissage, that might be the time that you might maybe get that reaction, like, because you're getting into deeper tissue, maybe just keep an eye out for those signals like we talked about, because this might be the time that you'll get some type of reaction because you're going in a little bit deeper.
Right.
But so it's definitely, so I guess it's pretty much everything that effleurage isn't. It could be compression. Yeah. It could be compression. It could be skin rolling. It could be friction. It could be kneading.
Wringing, lifting, squeezing.
Right.
Focused pressure and trying to get something to melt under, gradually introduced pressure, strumming across a tight tissue that might feel like a rope. That's exactly what I say, Cathy, is that Petrissage is everything else.
It's everything else.
Yeah. Yep. And I guess in general too, we should talk a little bit about, rate and rhythm. Generally you want to be methodical and rhythmic and slow, especially if you're trying to, promote that relaxation. If we're trying to wake something up. Sometimes a dog's rear end might be a little weak, or, if they have a neurological issue, then I might be a little bit more vigorous and faster in my touch. But generally, don't you agree? We're typically going very slowly, and again, with that intention.
Slow and methodical, unless I'm doing something like you said, unless I'm trying to wake up that rear end. And then I might be a little bit more vigorous over the hips, or maybe, the lower part of the back. It depends on the dog's diagnosis and what I'm trying to accomplish. But usually, typically slow, methodical, in tune. If you think about yourself in terms of yourself, if you've ever had a massage, that's typically what they do. And they'll do quadrants of your body. We'll do your back, your neck, your arm, your lower back, methodical, slow. And it feels good. Sometimes you might even fall asleep. But keep in mind, too, if you've ever had a massage that's gone too long, now your muscles are getting like a little fatigued, and they're like,
it gets sore. And I'm like, stop rubbing in the same place over and over again. I've had unskilled massage therapists, and, they just keep going back to that same place. And I'm like, okay, enough already. So again, our dogs can't talk to us. So just make sure that you are paying attention, that you're not mindlessly, digging in there in the same place over and over again. And, we talked about kind of having the flat open hand for effleurage, but to effectuate the Petrissage, your hand is going to be different. Again, you're going to be engaging maybe your individual fingers and thumb and different parts of your hand. I think about the meaty parts of my hand, along the outside, underneath, in the palm by your little finger. And then also that meaty area on the palm by your thumb. Those are the thenar and hypothenar eminences. And those are good, ways to get in there. But also, think about the size of your dog. If I'm massaging a Chihuahua, I'm going to be using my fingers. If I'm massaging
fingertips, maybe.
Fingertips. If I'm massaging a Mastiff, I've gotten in there with my elbow and forearm, gone, along their back and, again, their hips, their thighs. I often think about when I was, a therapist at the University of Colorado working in sports medicine. I mean, those dogs are like my football players, right?
Yeah.
And, and then you have the Chihuahuas that are like your little dancers or something. But I also want to mention, in terms of relaxation, to never break away, if you can help it,
right,
from the surface of your dog. So again, they maybe can't see you. You may be behind them at their rear end. And if you stroke, lift your hand, and then reintroduce your touch in a different area, that can be quite startling.
right.
So maybe the pressure's going in one direction. That's the more therapeutic effect. But then you glide back lightly to that starting point. So
Sometimes,
the pet knows
Chris,
at all times where your hand is.
Exactly. And I try not to break contact ever. And if I need to, I'll just go hand over hand, glide with one hand, put my other hand, glide, lift that one hand up and replace it, again and glide. So I usually will end all massages with an effleurage.
Yep.
I've continued that contact, so
Exactly.
I might do effleurage, petrissage, and then effleurage again.
It's a great way to finish because again, we're working toward that body center. So any waste products that we've gotten out of those dense, tight tissues, now we're helping the body to get them towards its organs where it can process those waste products, the liver, the kidneys, and so forth. So we want to facilitate that circulation, that movement toward the heart, toward the abdomen to get rid of that. And that also brings me to a point when I'm thinking about waste products. Make sure that your pet is hydrated. Try to encourage them to drink before the massage as well as after, because that's going to help with that circulation. Same with people, we get told that kind of thing all the time, to get the best and most comfortable massage, make sure you're hydrated going into it, or it's much less.
You get that little complimentary bottle of water at the end. Yeah. You get that little complimentary bottle.
Yeah.
Chris, let me ask you this. How long do you think a full massage, how long do you think it should take?
Well, I think that's a bit of a loaded question because if I'm doing a full body massage on a Yorkie, it might take me 10 minutes.
Yeah.
If I'm doing, and again, I've gotten consent and I can do a full body massage on a giant breed dog, that might take me 30 minutes because you're just covering more area. What do you think about that, Cathy?
I was going to say, when you said Yorkie, I was thinking 7-ish, like maybe 7 to 10.
5 to 10 minutes. I was going to say 5 to 10 minutes.
I don't know why it was 7. I don't know, but yeah, like
good compromise.
A good compromise. So yeah, somewhere in that 5 to 10 minute period. And with larger dogs, I think 20 to 30 probably, as long as the dog is consenting in that 20 to 30 time frame.
And I certainly have dogs that I've been doing soft tissue work, but this includes other techniques too. So, we've done shows on passive range of motion and stretching, and I do, some joint work, joint mobilizations. And with that, of course, the massage. So, I would say on my regulars, that whole process probably takes me maybe 20 minutes aside. So like 40 minutes, but again, that's including all these other things. Yeah. So if you're strictly doing massage, I agree with you, Cathy. And I do think that's, I often say like any massage is better than no massage. So if you think like, oh, I don't have 30 minutes to massage Marmaduke, spend 5 minutes just massaging their neck.
Right.
It's so great. Do anything. Yeah.
Can we talk a little bit about skin rolling? Because we definitely covered this in our YouTube tutorials. And I think it's something so simple that owners can do, and dogs love it, and cats love it too.
Yes, Cathy, let's talk about skin rolling and maybe some compression. And if we have time, maybe even a little bit of scar mobilization.
Ooh, fancy. I love the skin rolling technique. And I like to do it a lot on my dog because he's got a lot of skin. And what I'm doing is I'll start just like like we talked about before, about going from one position to the other. So from the butt end up towards the heart, I'll just grab and roll up the skin in between my fingers, and I'll roll it. And there's a tutorial, so it's a little bit easier to see what I'm doing when you see the video. But picking up the skin and rolling it. And actually, there's just a little bit of a tugging technique. It's very gentle, like lift and roll, little tug.
So Cathy, I think, in observing you doing this on our YouTube tutorial, you're lifting the skin, you're grabbing, you're lifting, and then you're pushing that skin kind of away from you to that next spot. Right. And then grabbing, lifting, and pushing again. And of course, it depends on, again, the size of the dog, how loose their skin is, and so forth.
Yeah.
Sometimes I just lift. Sometimes I just pull it away. And the neck is always a good place. If you're going to kind of practice, I think it's maybe doing it around that neck area, because dogs, traditionally, think about the mom, holding the puppy by the neck, they're built to have some excess kind of skin in that area, no matter what the breed is. So,
right. And when you lift it up and roll like that, you're lifting up the fascia, right, off of the muscle, and we're getting oxygen and blood flow to that area.
Right.
And sometimes if you have dogs that have scars for whatever reason, good blood flow doesn't get to scar tissue area. You gotta, and sometimes it adheres to tissues underneath, and that limits mobility. So that skin rolling, is good for that.
Yep. It tugs and causes discomfort, because the job of the scar is to knit tissue together. And so it tends to bind, and some beings are more predisposed to laying down excessive scar, which can be very mobility limiting or uncomfortable. And so, let's just quote roll right into scar mobs, because what I'll do, again, post-operatively, and we can start pretty early, is, kind of pushing toward that incision or toward that injury. So you're not applying traction as if you were going to open the scar. You're actually pushing as if you were closing that wound. And that's kind of freeing up the tissue around it. And I go from all directions and kind of paying attention to where it's more mobile in terms of that skin, and starting very, very light. Yep. And then over time, getting a little deeper and actually touching the incision itself. So again, talking about something post-surgical, let's wait till those sutures and staples are out. It's closed. And then I'll take, maybe my forefinger or my thumb and put it right on the incision and do really tiny little circles.
Yeah. Little.
And what's that?
I'm sorry. Well, you're not lifting, right? You're just
okay. You're kind of doing just gentle pressure.
Yeah.
But Cathy, earlier you were talking about more chronic scar tissue, I think. And over time, what we want to do is be able to lift that incision just like we can lift the skin around it off the underlying tissue. And for people that don't know what fascia is, it's basically the saran wrap of our bodies. So there's a huge layer of saran wrap, if you will, under our skin, fascia under our skin. But then it dives in these planes around our organs, envelops our muscles, and can really be a source of tightness and movement restriction. Mm-hmm. So a lot of lay people don't know what fascia is or the function of fascia, but it can be a real problem, and you can easily address it by doing the skin roll.
Right. And let's talk about, as we're wrapping up, let's talk a little bit about compression, because I really like to use compression all over the body. And sometimes I'll just incorporate it into the massage itself, because it's such a great body awareness exercise.
Mm-hmm. It can be a good introduction to, like the effleurage is, you can introduce via compression. So describe that, Cathy.
So, I'll talk about how usually what I do with the limbs is I want to use the word sandwich. I'll put their leg on my hand, and I'll put my hand on top of their leg, and then I'll just gently compress from the bottom of their leg up the leg. And I'll do that to all four limbs. And then when I get to the body, I will just gently compress towards the center of the body. Yeah.
Yeah. I love it. And I like how you said that it really, again, enhances that body awareness in areas that we, may not pay attention to otherwise. Yeah. So,
and I think that's all on our YouTube channel. So if you haven't subscribed to that, go to PetAbility podcast and subscribe to that. We have lots of great tutorials and videos, and our shows are on there. So go there and subscribe and take a look at all the other things we have there as well.
Yes. And finally, let's talk about our other sponsor, because what great time to introduce some enrichment, some reward when you're done doing the massage by subscribing to a Dog's Best Life box. The website is adogsbestlifebox.com. It's filled with all kinds of goodies, enrichment toys, puzzles, treats of various types, chews to help calm them. You can get it one time, you can get it monthly, you can get it quarterly, which is a seasonal theme. And they're constantly adding to their product line and what we're able to order via the website, adogsbestlifebox.com, such that now, if you just wanted to try maybe a product, you can order one item.
Matt gives adogsbestlifebox.com a 10 out of 10 or 4 paws up. He loved everything. He loved everything in that box. So if you're thinking about ordering from adogsbestlifebox.com, again, go to their website, use our promo code PETPOD22. That's PETPOD 22, capital letters. You'll get 10% off on your first order, and they'll send you a special gift too.
Yes, which is a fantastic treat pouch with a squeaker. And if you aren't subscribing or following us on Instagram, I think, Cathy, we have some videos and pictures of my dogs enjoying some of their items. Yeah. From adogsbestlifebox.com as well. So check it out. You won't be disappointed. Use PetPod22, all caps, and get your discount and your special gift.
So, Cathy, thank you, Chris. This was wonderful.
Yes, Cathy, this was a great show. You can see I get all fired up when talking about things that I'm passionate about, and you do as well. So people, get out there, get your hands on your dogs. Don't be afraid. Don't overthink it. But please check out the YouTube channel and listen and share this show with your family and friends, because it can just help so many out there.
All right, then. Thank you, Chris. Bye.
Bye, Cathy.
Thank you for joining us. We hope you enjoyed our show. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
For more information about Cathy's books and living with blind dogs, please visit enableyourpet.com. Thank you, and please tune in next time.